If you don't care about coffee, you won't care about this video, and that's okay. Most of us, we love our morning cup of coffee, and so it matters a lot when is it okay to get back to coffee after bariatric surgery. And the situation here is that almost all bariatric surgery programs recommend stopping coffee and caffeine when the liver shrinkage diet begins before surgery. And then, at least in our practice, we're not great at telling people when they can get back to caffeine after the surgery is done. I'm going to explain first of all why we want to avoid caffeine around surgery before and after, and then we'll get into some recommendations about when you can start back. So the why of avoiding caffeine is that caffeine is a diuretic. Diuretic is the medical term for a substance in the body that forces the kidneys to secrete extra urine, often so much that you actually become functionally dehydrated. Now, on the liver shrinkage diet and after the surgery when folks are not eating, we expect people to be in ketosis, which is mostly a good condition. It's a fat burning, but ketosis is also a diuretic effect, or it has a diuretic effect. And so ketosis is pushing fluids out of your body as well. And so we don't want to stack together the diuretic effect of caffeine and ketosis at the same time, especially after surgery, when you may not be drinking fluids very comfortably because you can easily become dehydrated, and that leads to more nausea, worse hydration, and rehospitalization, all kinds of stuff that we don't want. So that's the reason that we want to avoid caffeine leading into surgery and after surgery, so that we can maintain the best hydration. When to go back onto caffeine, basically it's when ketosis fades away and when we're hydrating easily, drinking fluids comfortably. Now, drinking fluids comfortably, you'll know when that's happening. When ketosis fades isn't super tricky. I just need to teach you a little bit about it. So ketosis fades at 2 or 3 weeks after surgery, and the fading of the ketosis coincides with what people call the 3-week stall. The 3-week stall is the time after surgery when your weight loss slows down a lot, or maybe even stops for a week or so. And the situation is that while the ketosis is very active and you're in this diuretic effect, your body forces out lots of fluid, which is heavy, and so you lose weight massive, big time, super fast. It's great. And you're burning fat too, but some of it is water loss. Then as the ketosis fades, your body will actually, in a healthy way, reaccumulate its natural fluid stores, and so the pace of the downward trend on the scale will slow or stop. And that might be a little bit scary and concerning, but it's an expected thing. And like I said, that's also your way of knowing that the ketosis is fading and it's safe to go back to your caffeine. Now, one other concern that comes up, some surgeons believe that caffeine is an irritating substance and might create ulcers, especially for gastric bypass patients. I haven't seen that in my own practice, and in preparation for this video, I did a pretty good literature search. I did not find any literature connection of caffeine with ulcers, but still I want you to follow the recommendations of your home bariatric program. One other part of the coffee discussion, and I've created a whole other video on this topic, the key thing is, what do you put in your coffee? I really want you to avoid all artificial chemical things putting in your coffee. And so I'm talking about the artificial non-dairy creamers like Coffee Mate and International Coffees. I know they taste great. They've got wonderful flavors, but the sweeteners in those substances are going to act just like sugar in your body, and in the long run, they will sabotage your weight loss. By the same token, it might seem so intuitively obvious to put a protein drink in your coffee. I mean, you get a little bit of softening of your coffee, you get a little extra protein, it seems like a great idea. I'm kind of opposed to protein drinks for people as well. Once again, it's because of the artificial substances, the sweeteners, the preservatives, the fact that it's artificial protein, and I don't think you need to push that extra protein. That's also a separate video, but short version, I don't think you should put protein drinks in your coffee. If you want to soften up your coffee a little bit with some actual natural dairy, half and half, I'm okay with that. I don't think there's anything that's going to make your coffee sweet that's really good for you. So I'm going to ask you just to get your coffee down to the minimal tolerable level of sweetness, and if possible, no sweetness, just the half and half. Okay, so that all being said, once you get your hydration taken care of, once your hydration is reliable, you are welcome to go back to your coffee. Okay, good luck.